Hi, Stephen the hospice nurse here. One of the most critical aspects of hospice is the individualized care we deliver to each patient. That means developing comprehensive care plans for our patients is super important. Today, I'm going to show you some of the awesome smart care planning features in Hospice Tools eDocs. When we log in, we see our dashboard, and we'll click View Charts. Today, we're going to work on our patient Derek, and we can do this on the desktop or on our mobile app during the visit. It makes no difference. We'll go into Derek's chart, and let's go ahead and create a care plan. Hospice Tools gives us a number of ways to navigate into care plans. One way is we can click on the tab Plan of Care and just click Start New Care Plan. Like many of the forms, it's broken into easy-to-navigate sections, so we can build a personalized plan piece by piece. The first box at the top of the form is the Problem Being Care Plan. We can either enter Derek's problem with free text, or we can choose from a care plan library that pops up as we type. For example, as soon as we start to type the word pain, the care plan library filters and presents a number of options we can choose from. If we choose pain, we can then click on Suggestions, and we see suggested goals related to pain. And if we want, with a click of a button, we can add any of these suggestions to start our care plan. In this case, let's enter nutrition as Derek's problem. When we click Suggestions, we see a number of goals that pop up related to nutrition. And we can select any number of these goals. We simply click on the box and the suggestion is added as a goal. This gives us a starting point of goals that are commonly associated with nutrition. In this case, we'll select that the patient wants to be in control of what, how much, and when he wants to eat. Once we click Next and save the problem and goals, the care plan opens up observations and occurrences that are related to this specific problem. In Derek's case, his nutritional impairment. We'll put in here that Derek expresses concern with a lack of appetite during breakfast, but he is eating 25% of lunch and dinner. Once we've entered the observation of the problem, we can use the drop-down menu to rank the severity of the problem. We can choose mild, moderate, or severe. These ranking fields will provide the data that we can use to analyze over time. And whatever number we choose in this rating system will feed directly into our QAPI, or Quality Assurance Performance Improvement. In this case, the problem is moderate, and we can then list out different interventions and outcomes. Similar to the goals box, we can free text and use suggestions. For example, let's free text here that the patient is on a vegetarian diet. And we can pull in any suggestions that we'd like. So we'll mark that we will instruct the patient that appetite is usually best in the morning and to plan meals accordingly. We're also going to select that we'll encourage the patient to sit up for his meals and to drink less liquids with his meals. Now we click Add, and in our section Interventions and Outcomes, we have a list of suggestions to guide our care plan. We date and timestamp the plan, and if it's complete, we click Save and Submit. And we can see that our care plan for Derek's nutrition is off to a start. We have goals, we have our problem, severity score, and interventions and outcomes. This combination of being able to tap into the robust forms library and easily pull in from built-in list of suggestions, interventions, and goals, as well as the ability to enter free text, creates the perfect combination of getting good documentation while also being able to customize and personalize the documentation to each individual patient. Unlike other clinical documents, care plans are addressing ongoing issues, so the care plan documentation needs to be flexible to be easily updated as the situation changes. Let's see how updating a care plan works. And there are different ways we can access care plans in a given workflow. When we start the care plan, we went in through the chart into the Plan of Care tab. However, we can also access the care plan when we're at a nursing visit directly from within the nursing visit note, without having to back out and navigate different tabs in the system. In our nursing visit documentation, on the top left is a drop-down menu that allows us to easily navigate between sections. We'll simply mark our visit date and time, and then we can pull down Care Plan from the menu and jump right to any existing care plans in the patient's chart. Now we can dive directly into the nutritional care plan from within the visit note during the actual visit, without having to exit the visit note to get back into the patient's care plan. This really represents the actual workflow hospice nurses and other team members experience on a day-to-day basis. We're seeing and updating the picture of the patient in each care plan while we visit the patient. This allows us to enter real-time information and present the most personalized, accurate, and specific picture of each patient. Let's go into the nutrition care plan. The care plan information is laid out clearly. And now, let's say a few days have gone by and we want to update the plan. So, we just click New Update. And we see we have a new Observations and Occurrences box. We'll note that we visited the patient and the facility staff reports that the patient consumed 100% of his meal at breakfast today and there are no concerns. We can see that the interventions from our last visit are working. We'll downgrade the severity ranking of the problem from moderate to mild. Also, we'll document that the patient is on a vegetarian diet, and we can use the suggestion library to pull in additional interventions. This time, we might instruct the patient or family to allow the patient to rest before meals. We might instruct them that there are no dietary restrictions in order to increase calorie intake, and we might note to encourage him to sit up for meals. We can also edit the suggested interventions. For example, we may have instructed the facility and not the patient, so we can simply edit with free text in the intervention box to customize it specifically to our patient. Then we date the care plan and click Save and Submit. And just like that, the new update added to the existing care plan. And the care plan will stay in existence for as long as we need it for our patient. We will keep updating the existing document so it always gives an accurate representation of the patient's changing condition. We can go back to the Plan of Care tab and see this document is listed with the start date, last update date, and is marked as active. If we back out of the patient's chart and enter from the dashboard, or from here, we'll just click on the tab All Types. We get an overview of the documentation in the patient's chart. And we see that Hospice Tools presents us the chart with a color-coded system, so we know with a glance the status of each document. Red is unfinished, green is submitted, and blue is active. Here, the care plan is blue because an active care plan is a living document that will be updated as our patient's condition changes. If we decide, for instance, that nutrition is no longer a problem, we can go in at any time and close out and discontinue the care plan. We simply go in and click the Discontinue button. We'll enter the reason for discontinuing the care plan. In this case, it's because the goals of the care plan are met and nutrition is no longer a problem. And the care plan is discontinued. We also have the option to reopen it at a later date, but for now it's been closed down and we see that the status is changed. And that is how we manage care planning in Hospice Tools eDocs. The easy navigation with suggestions and customizations makes for great documentation and personalization that matches our workflow. That's how Hospice Tools makes care planning super simple. Hospice Tools, how hospice happens.